Okay, hi, I'm Sage. This is my blood administration pass off. So I'm just gonna be checking my patient's orders first, making sure that there is an order for the blood transfusion and that my blood has been typed and cross-matched, which looks great here. And I'm gonna make sure that my patient has signed the consent form. It looks like he did, and we're just gonna go talk to him about that real quick too. Just walk in. Hi, my name is Sage. I'm a nurse today. Can I get your name and date of birth real quick? Okay, looks great. I'm gonna go ahead and close these curtains. Give us a little bit of privacy. I'm gonna close those ones. So the doctor's ordered the blood transfusion. You already know about that. You did sign this. Are you still okay going forward? Okay, great. I'm gonna set that aside for just a minute. So just some signs and symptoms or just some side effects of this transfusion can be like itching, hives, swelling, shortness of breath, fever. If you experience any of these, please let me know. If you experience anything unusual at all, just please let me know, okay? Okay, now at this time, I'm gonna obtain a set of baseline vital signs on my patient. So that's gonna be my blood pressure, my pulse, respiratory, my oxygen, and my temperature at all. Obtain those, okay? So now I'm just gonna go ahead and listen to your lungs real quick. I'm gonna assess for fluid overload real quick. So I'm just gonna listen to your lungs. Can you take a deep breath for me? Real quick, and again. And again. Another breath. Another breath. And another. Perfect. Okay, now I'm gonna listen to your lungs on the back side, so I'm gonna have you roll over for me. Back here. Help assist you rolling over. Okay, go ahead and take a deep breath for me. Deep breath again. Deep breath. Another one. Another one. And one more. Okay, perfect. Those all sound great. Now I'm just going to check your neck for any jugular vein distension. Back in bed there. Just checking, looking for anything. And that looks pretty good. If I noticed anything, I just alert the provider immediately. Okay. And so now I'm going to go ahead and just assess your IV real quick. I'm just going to make sure that we have an 18 gauge or a bore IV. Just make sure it's big enough for the blood. Make sure we have 2 IVs for this. Okay, looking for any swelling, redness. It looks great. I'm just gonna go ahead and flush it real quick. And at this time, I would also give any medications needed before the transfusion, usually 30 minutes prior to it. Make sure to scrub that real nice and good. Okay, that flushes great. Go ahead and just take that off for a minute. Okay, now I'm gonna go ahead and get all my saline ready. Clamp everything. Just try not to jump on the floor. Okay, I'm going to go ahead and just hang this up high up. Just still got everything clamped, so I'm gonna go ahead and just put this up with my son. I'm just gonna make sure to fill all the way past that white top. Just like that. Okay, I'm gonna go ahead and prime it, which I can grab the garbage for that. Okay, now that that's all primed, I'm gonna go ahead and just connect it to my patient. Clean the thing really good. I'm just gonna make sure to clean this for a solid 30 seconds and just scrub vigorously. Okay, 30 seconds later. I'm just gonna attach this to me for a second. Okay, and all that's still clamped. Okay. Now I'm gonna go ahead and go to the blood bank and grab my blood. While I'm here, I'm just gonna double check with the blood bank that we've got the right blood, the right patient, all that, and that looks good. And I'm just gonna observe it, make sure there's no bubbles or cloudiness, and the color looks good. Everything looks great about this. And so now I'm gonna go ahead and have my other nurse come and just double check this with me. So I'm gonna just make sure that we've got our Darius Hansen. Yep, Darius Hansen. Date of birth is 8/10 and year. 8/10. And then I'm gonna go ahead and double check with the blood on this. I've got, he is A positive, and this blood is O negative. Yep. Perfect. And I'm gonna double check the expiration date with here. So expires 1/3/23. Perfect. And then I'm gonna go ahead and just read off this number to her. 00, and then have you read 0 to me. 88 084. Perfect. Okay. And then I just also, while you're here, just have her double check the consent form that he has signed it. Perfect. Looks good. Okay. And so we are all ready to go. And I'm just gonna make sure that I use this blood within a 30-minute period after removing it from the fridge and administering it within a 4-hour period. And if my patient experiences any reactions with this, I'm going to make sure to stop the transfusion and change out the tubing, flush it with saline, notify the provider, and then send the blood back. And then my line is already primed, should be good to go. And I'm just gonna go ahead and walk everything for a second. Alright, so now I'm gonna go ahead and start. If you start experiencing anything unusual, please just let me know. Okay, well, we're just gonna assume that the blood is going because apparently my tubing's not long enough to reach it. But as soon as it's go, I'm gonna let this run to my patient and I'm gonna slow it down and make sure that it's going for at 2 mils per minute for the first 15 minutes. And I'm gonna make sure that I stay with my patient this time. Okay, and I'm just observing for any reactions. You feeling okay? Great. And then I'm also going to obtain a set of vital signs after the first 15 minutes. And after that first 15, I can adjust it to the prescribed rate. Make sure to document everything. And then we're just making sure it's okay. And then I'm also, after that's done, I'm gonna just flush my line with saline. So I'm gonna go ahead and just clamp off my blood. And I'm gonna let the saline go through. Great, it's dripping really well. I'll let that whole thing flush out. And I'm gonna go ahead and clamp everything. And yeah. And I'm gonna place everything in my red bag. And then I'm just going to educate my patient on some signs and symptoms of delayed reactions and just to let them know what they might expect and what to do with that. And then I'm also going to obtain a set of vital signs an hour afterwards to make sure we're still doing okay. And then, yeah, and so now I'm going to go document it.